Hello and welcome to another Amati Insights call. As usual, before we start today, please do take the time to review the disclaimer on the screen, which is also available on our website. The point here is to highlight that what we're discussing today doesn't constitute investment advice. Everyone's circumstances are different, and it is essential to do your own research or consult a professional for investment advice that's tailored to you. But that said, this week's call is entitled Genomics, the Next Chapter, and it's really a kind of update on where the genomics industry is and some of the changes that we're seeing across the investment landscape. So just as a brief recap, many of you will know that a new sequencing technology called next-gen sequencing was developed around 2005, and it enabled a very significant reduction in the cost in gene sequencing. And this unlocked new discoveries about the links between genetics and the propensity of people to develop conditions or to respond to treatments. And initially, this was focused in academic research, but moved along the value chain into drug discovery and now into clinical diagnostics. And in fact, the company that dominates this space, Illumina, now 60% of their business is in clinical diagnostics, and the addressable market there is much bigger than it is for the other options, for the other uses for the machines.
So what's been happening with the cost of this genomic sequencing, and is it now cheap enough to unlock this really valuable new markets?
Yeah, well, the changes have been huge. So going back to when sequencing first began, which used a different technology back in 2000, it could cost $100 million to sequence the genome. And that has come down progressively to about $200 today. On the leading NGS next-gen sequencing machine at Illumina, which is called the NovaSeq X. And companies are pushing for that cost to come down even lower. So $100 is being talked about now on the roadmap. But interestingly, talking to sort of key opinion leaders in the space, they suggest that really cost is no longer the issue. It is effectively cheap enough. And it's now just about 40% of the total cost of the workflow for doing a diagnostic process, if you like. In fact, one genomics lab that we spoke to said that it's now the cost of the sequencing is comparable to the cost of just shipping samples around. So yeah, it's definitely cheap enough now.
Yeah, I mean, the ultimate test of these things is often what's called health economics. What is the clinical value of this diagnostic result in saving costs later in the treatment journey? And this results vary, of course, but one data point which was striking to us in the context of a neonatal and intensive care unit, so kind of very sick, very small children, where the genomic testing allowing for early identification of genetic conditions has $130,000 in net clinical benefits. So that's just a no-brainer kind of value for genome sequencing. And I mean, this is an extreme example, but we're at this very exciting moment in lots of clinical areas where you have this price elasticity, more tests are worth doing now that they're cheap enough, combined with the scientific and clinical progress that it's unlocking new and larger applications.
Yeah, I mean, that's a good point. Where are we, do you think, in terms of leading edge of the whole developments in genomics and particularly diagnostics? Where are we in that whole process?
Well, it's a sea of acronyms out there. There's lots of kind of vectors of growth, if you like. Oncology is one of those. Just to list those acronyms: ctDNA, MRD, MCED or MCED, and CGP are the orders of the day, and they all relate to something called liquid biopsy. So ctDNA stands for circulating tumor DNA. So cancer, when it's developing, sheds a little bit of its DNA into the bloodstream, and you can spot that with this technology, with this liquid biopsy technology, long before the cancer becomes symptomatic or is visible on the scan. So that manifests itself in many different ways. One of them is MRD, a minimum residual disease test. So after the cancer has been treated, you want to make sure it's gone completely. And there, spotting this little fragments of ctDNA after the treatment allows to detect early that the cancer has returned and kind of stop it progressing long before you can spot it in any other way. Potentially more exciting area is MCED or MCED, which stands for multi-cancer early detection test. So spotting cancers via this circulating tumor DNA long before symptoms appear and kind of initiating treatments a lot earlier, where they're likely to be less disruptive and more effective. And then the other one, kind of in the field of precision medicine, something called CGP, comprehensive genomic profiling. For example, decoding cancer tumor DNA itself to detect its unique genomic signature and kind of learn to detect it better and target it better with precision therapy. So loads and loads of good reasons to do sequencing in oncology.
Yeah, I guess broadly, as the kind of technology improved and the costs have come down, we've been able to do more sequencing, which has created more information and more knowledge, led to more clinical value, more biological understanding of the genome, and that whole kind of approach is known as whole genome sequencing. Really was essential to kind of unlock the whole process, the book of life, as we call it. And what that did was unlock the fact that certain genes or gene mutations are responsible for particular conditions, and these became identifiable. They're kind of known as keywords in the industry, and these keywords, these mutations, can be found using PCR tests. So remember those from COVID. For a while, PCR tests were a very effective way of finding a small number, a limited number of genes, small gene panels, as they're called. But as we've developed more knowledge, and we've found that there are more keywords worth looking for, and as the cost of reading the whole book, if you like, has come down, it's now become cheaper and more effective to use whole genome sequencing than to use those PCR tests. And another factor here is AI, obviously, because as we're accumulating more genetic information from more people, then that information becomes more valuable for finding some of these keywords and potential linkages in the future. And so AI is playing a big role here, and we're seeing this kind of virtuous cycle of more information and being able to take more from the information and do more with it.
Yeah, I mean, we're looking at industry is looking at the likelihood, never mind the possibility, the likelihood that this whole genome sequencing, this reading of the whole book, if you like, will be done at multiple junctions, many times during the disease treatment journey. MRD is considered, in future to be a kind of a standard post-treatment testing protocol. Practitioners talk about millions of MSED, the early detection tests, in the US alone within the next 5 years, which is a massive increase from the current levels. And beyond the oncology, where you could argue it's a very acute disease, cancer, it also happens early in pediatrics. So in rare diseases in pediatrics, it's now viewed as best practice to do whole genome sequencing on any child presenting with distress symptoms, either in the hospital in the neonatal ICU or in outpatient setting, displaying any symptoms associated with those rare genetic diseases. And here's another acronym for you: GNBS, genomic newborn screening. Industry is piloting this in a number of states in the US, effectively screening every newborn child, the whole genome. And it looks like the value of detecting in very small minority of children actionable conditions early, the clinical value of that overcomes both the cost of doing this mass screening and any ethical concerns or conservatism that affected this field in the past. So it's a fast-growing market, and is giving rise to very fast-growing diagnostics businesses. If we look at the kind of ecosystem of specialist genomics testing companies, companies like Guardant Health, which is focusing on cancer biopsy, Natera, again, cancer specialists, GeneDx, which is a pediatric rare disease specialist, Grail, Exact Sciences, again, various cancers. Their revenues are growing between 20 and 40% per year, which are very rapid growth rates, and in some cases accelerating. And there is a clear strategic value in the field. Abbott Labs, which is one of the global leaders in diagnostics across all the modalities of diagnostics, recently bought Exact Sciences, very expensive acquisition, demonstrating strategic value in the space. Now, usually when the growth like this occurs, we want to look for picks and shovels, the kind of the key enablers that benefit from this growth. So what's happening in that enabler space?
Yeah, well, I mean, there's quite a lot happening, actually. If we looked sort of 5 years ago, the really clear beneficiary of all of this development would have been Illumina, and was Illumina. In fact, it still is really. They still dominate the next-gen sequencing markets with 60 to 80% market share today. even in clinical diagnostics, because it has a great reputation and the machine's performance is very good. And that's obviously very relevant in diagnostics. But the competitive picture is definitely changing. So there are some new challenges that are coming to the market or that are in the market. Companies like Ultimate or Element Bio, Complete Genomics. So the picture is definitely changing. And then also we have this change from short read, which is what Illumina does, to long read, which is a kind of more detailed, covers a lot more base pairs of DNA. That's promoted by a couple of companies like Pacific Bio and Oxford Nanopore, which is a UK listed company. But potentially the most disruptive competitor probably is Roche. And they have a very strong position in clinical diagnostics anyway. So they have a good reputation there in other areas, and very good service and sales. And they've just launched this machine called Axelios, which is their own next-gen sequencing machine and claims higher efficiency and flexibility than the Illumina machine. So interesting to see how that dynamic plays out. But for us, as you mentioned, we like to look across the whole value chain. So we take quite a wide aperture when it comes to these areas of innovation. So we look at pioneers, enablers, and adopters, and that's been very relevant in this space. So there's a lot of innovation, obviously, but we're focused on where are the best business models and which are offering the best risk reward. And when we looked at this space, when we first launched the fund just over 3 years ago, we looked at Illumina, but we passed on it because valuation was too high. There were some emerging competitive threats which were not really being factored in. And that competition still keeps us on the sideline today, although, to be honest, the valuation is a lot more compelling now than it used to be. But it's the testing companies that are really growing quickly now, and and most are potentially very interesting, although a lot of them are not yet making money, which is obviously important for us with our focus on profitability and cash generation.
Yeah, I mean, it's a frustrating experience for us in a way because we see this rapidly growing ecosystem. Its future that's already here is just not only distributed exactly what we're looking for, and the challenge is to find the best business at the best price, which is we don't invest in unprofitable companies as a matter of course. So that keeps us on the sidelines for some of those diagnostic specialists. But we found very compelling value in one of them. It's called GeneDx, and it's has a very clear defined niche. It's this pediatric rare disease genomics. It benefits from a very unique data set of lots of patients and their families that they've sequenced over the years, so they can correlate disease and genetic code much better than their competition. And the result of that, they have 80% market share in their niche. And this is where this inflection point is occurring. The clinical practice now calls for whole genome sequencing that GeneDx does pretty much as a first-line test in more and more settings with pediatrics. And it's a profitable company. It's not only growing very fast at an accelerating pace, it's also profitable. And the other lateral beneficiary of that is LabCorp. It's one of the two largest US central lab testing companies. They do every possible test under the sun. And for if you like, a more commoditized genomics test over the years, not maybe as differentiated as GeneDx's pediatric test, they will be a natural venue where some of that testing or a lot of that testing will happen. So it'll be a mild accelerant to their growth and their margin. They're not as fast growing, but also represent much better value in terms of valuation multiples. And interestingly, we talked about this unprofitable companies that are often on shaky ground when economic cycle turns. One of those companies was Invita, once a high-flying genomics testing company, which went bankrupt after COVID. And LabCorp acquired most of its IP, most of its tests for Song, for a fraction of its former value. So again, this is probably going to be a significant contributor to their genomic growth over the years.
Great. I think we're probably out of time again. But thanks for that, and hopefully we'll see you all in a couple of weeks' time.
Thanks. Thank you.